Good evening and welcome to Ankle Movers Part 2. Now see what we do is very at a very high pace. We just go through that yesterday's figure, right? So that it is just a recapitulation of what we were discussing yesterday, and then we will continue with our today's topic. So what we were talking about yesterday was that fibrous septa, right? Yeah, one more thing. I got several mails about the direction. That is whether that was right side or the left side, right? Yes. Good evening. Good evening. Right. So we'll talk about that also. So no confusion with complete clarity. What three things which were to be discussed was one, that on the back side, yes, it was on the back side. There was the transverse intermuscular septum. True? Intermuscular septum. And that was dividing the whole thing into two parts. That is superficial posterior and the deep posterior. Right? That was easy. That was easy. And then we had that anterior intermuscular septum. That's true. One male was that what is anterior crural septum? No, it's the same thing. It is anterior crural intermuscular septum. It is one and the same thing, right? So anterior crural and the posterior crural, right? It's the same thing. So here it would be the posterior crural, right? Crural intermuscular septum. And that's how anterior was dividing into, now you can even visualize between anterior and lateral, right? Anterior and lateral. And then this was dividing into lateral and superficial posterior. True? Right? So lateral and superficial posterior. Right? I'm going a bit fast. Okay. As I said, you should draw that figure along with me. Now today, just for the clarity, say if I'm telling that say this is tibia, right? This is fibula. So it and this is anterior, right? And this side is anterior. So which side are we talking about? Obviously, right? Say so this would be the medial, right? And this is anterior. So as if we are talking about our own leg. So this is what? Right side, correct? Right side. Now in figure, right? Don't be confused, right? Today we'll try to do this figure of both the sides. But remember one thing, this is like as if we are drawing our own leg, right? But when we see it on screen, even if it is right side, but it would be other way around, right? It is like the way I say hello, right? I shake your hand, so your opposite side would come, though it is right side. You're getting my point, right? So don't be confused. This is, I'll just write down as if it's our own leg. Say, while studying anatomy, I always say felt that if we try to learn things as if it is in our own body, it becomes much easier, right? Otherwise, when it is on the opposite side, so we have to visualize a bit. But when it is like when we say, okay, this is my tibia, this is my fibula, in between it is intermuscular septum, this is anterior, this is posterior, it becomes much easier, right? Okay, so let's draw it high speed, and we change the color to blue, and in between it is interosseous membrane. So interosseous membrane, right? Not the Apple iOS. Okay, so this is interosseous membrane. Because this tibia is subcutaneous, so that's why we'll be drawing our margins from here. Fibula is not subcutaneous, so we'll be making it like this because it will be forming the lateral compartment, right? And let's draw like this, right? not very artistic, but scientifically correct. Okay. And let's draw those three septa. That's anterior crural, right? Anterior crural intermuscular septum or anterior intermuscular septum. This one would be the posterior. And then we have got all the way from fibula, it will go like this, right? Making this as the anterior compartment. This one would be the lateral, and then this is deep posterior, and this one is superficial posterior. We are very comfortable with superficial posterior, right? Superficial posterior, because we have learned that gastrocnemius, soleus, and the plantaris. So that is through. Fine, right? That is through. Then in the anterior, we talked about tibialis anterior, right? Still there are three more, right? So I'll just write +3, right? I'll just write +3. In the deep, we'll be learning tibialis posterior, right? And still again there are +3, right? And on the lateral side, there are three muscles, right? I'm sorry, on the lateral side, there are two muscles, and they are, say, peroneus longus and peroneus brevis. And then over here, there is peroneus tertius, right? Peroneus tertius. So the muscles which we have written, will be talking about it. By the way, there was one mail that what is, in fact, there were two questions. What is peroneal and what is, say, tertius, right? Okay, tertius is easy. Tertius means third, right? So obviously peroneus longus is the first one, peroneus brevis is second, right? So we will say that this is the third peroneal muscle, so that is peroneal tertius, right? So that is easy. Regarding this peroneal, right? This is a bit tricky. It is like in Latin, right? They say perona, right? Perona. Perona means it's like a buckle. Now, when we'll see the attachments of peroneal, at that point we'll really feel that yes, this is acting like a hook. This is like acting like a buckle, right? A very classical, typical insertions are there. So more when we'll be talking about it. Right now we are not say drawing all those vessels and nerves into this, right? We'll see to that as we proceed. So this was just for the reference, and do remember that as if this is the right side in our body, correct? Right side in our body. So we'll keep on drawing this figure again and again wherever there is confusion, right? Because once you have understood today's session, right, you will be very happy, because then only the soul is left out, rest everything is through. Okay, let's start. So here it is. The first thing which we'll be learning is, right, that was the investing layer of that deep fascia. So that deep fascia, and it is, what was the investing layer? Investing layer is that layer which is covering all the muscles, right? We need to cut this, right? And not only that, we'll also be cutting gastrocnemius and soleus, because we really want, now we are confident with gastrocnemius and soleus. We know that both of them, they'll be merging together and they'll be forming this calcaneal tendon. So we'll straight away, right, without any mercy, heartlessly, we'll be cutting gastrocnemius and soleus, right? Because our purpose is now all those intermuscular septas, right? That's what we really want to see. So here it is, right? They are divided, right? So we here it is divided. What we see in this, right? See, this is a better look, right? Detail. So here it is, right? That is investing layer, right? That is all deep fascia. And here it is that muscle itself, right? Our all divided muscles, that is gastrocnemius and soleus, right? Collectively, we have divided them. And can you appreciate, now this is, I'm just zooming it. See this portion, right? This portion, I want you to see this portion, right? Some fibrous, light fibrous tissue. Okay, let me remove this. Huh. So this is our first candidate for today, and that is transverse intermuscular septum, right? Transverse intermuscular septum. Unzoom. Okay. We would like to see it further, but first let's see where exactly it is attached. Now, say when we were drawing the figure, right? So here was the tibia, right? This was the fibula, and this was interosseous membrane. So this it was going something like this, right? So it means that it is going all the way, right, to the tibia and fibula. That's where it is getting attached, right? Let's see its attachment. So here it is. See how it is attached all the way, all the way. This is like tibia, right? So attachment of tibia. It has to be on tibia, right? So on tibia, attachment on tibia, almost to the full length, right? But the difference is that on the upper fibers, they are bit light and they start getting condensed as they go below. Sorry, as they go below. And say it is on tibia, and I rotate the whole thing, right? So now we are watching it from the fibular side. So that's where this transverse intermuscular septum on fibula. Okay, let's see it if we remove all the muscles, right? So what we did is we removed even rest of the soleus. So soleus is also now fully removed. Obviously, to remove soleus, we have to remove gastrocnemius, so that has also been removed. And now we see this, that is the transverse intermuscular septum. And immediately we figure out that here it is light, but over here it is much thicker, right? That's much thicker. Now, there would be three muscles which will be between transverse intermuscular septum, right, and the bones. True? So, let's see over here what really happens to this transverse intermuscular septum. This side, right, this transverse intermuscular septum, it continues with, right, it continues with flexor retinaculum, correct? Flexor retinaculum. And say with respect to this, right, if we really draw a figure, right, so we have to draw it something like this, that this is tibia, on this side that would be fibula, right, this would be intermuscular septum, and think it like here what we are watching is as if we are watching that this gentleman, right, who is standing in front of us, right, who is standing in front of us. So his right leg will be pointing towards us. So I think one thing, we have to draw the intermuscular septum something like this, right? So that would be much better, right? So here is his anterior, right? So this would be his medial side, right? So this means this is his right side. Am I clear? Right? And then we just, because this is superficial, we just make this whole thing like this, right? And then there would be from fibula, there would be anterior and the posterior crural ligament, right? So this would be the anterior crural intermuscular septum, not the ligament, right? I'm sorry. So this is, and then this would be the posterior crural intermuscular septum, correct? And obviously this will be the lateral part, this would be the anterior part, and then from this, right, it goes like this, and we have got the deep posterior and the superficial. What am I doing? Sorry. This one would be the deep, yeah, deep posterior, and this one would be the superficial posterior, right? Got it? So that's how this is like the person who is standing in front of us. So I hope now things would be much easier and clear. Okay, let's move to our this image. So here is when we remove this investing layer, right? As we go deep, now see, just orient yourself. That's the investing layer. That's the investing layer, and we are just watching that what are these septas. See, there is one septa like this, right? There is a thick septa like this, right? All those septas. In between there are muscles. In this is anterior, right? This side, so this would be the posterior, right? So anterior, posterior, and we are watching from the lateral side. Okay, so I'm writing here, watching the lateral side. I should say from the watching from the lateral side. So it means if we are watching from the lateral side, these two septas, they must be anterior crural intermuscular septum, and that one is the posterior crural intermuscular septum, right? Say, for example, this is soleus, correct? That one is soleus. So that is posterior, and then there was posterior crural and the anterior crural, right? So this gentleman is in lateral compartment, right? This one is lateral compartment. Right? This much is fine, right? Okay. Right? See, that is the septum. So even if we pull it, right, it will see that it is passing all the way deeper, right? So this is like anterior crural, crural intermuscular septum. Okay, let's see further. Now see. So this compartment would be the lateral compartment. This lateral compartment can also be called as the fibular compartment, no doubt, or we can give it a nice name, peroneal compartment. All right, it means one and the same thing, peroneal. Now in peroneal, right, there is one peroneus longus. Was there some specific why you made transverse a little far from? No. Right, as I said, that this is, yeah, it was like pomegranate. I just had it. Uh, okay, okay. First, I might draw transverse like this, transverse like this. That's just, it is like it is dividing it into two compartments, right? So no other specific reason, right? Still, I said, let me just have a look at it, what I drew. Yeah, so this is like interosseous membrane, interosseous septa, and this one is the transverse. So no reason, it is just like that, right? From fibula to tibia, it should go dividing the whole thing into two parts. This is like fish and pomegranate, I like that, right? Function of septum, these septa, right? There are so many reasons. One, because it divides the entire all muscle groups into separate groups, and you'll find that these separate groups, they are having similar functions. So once they are separated into several groups, the entire function would be more effective because they'll be working into their own compartment. Same thing would happen even with the nerve supply, right? Okay, coming back to this, where were we were here. So lateral or fibular or peroneal, right? Now see, there are three: peroneal longus, so it would be a long muscle; peroneus brevis, it would be a short muscle; and third one, we'll call it peroneal tertius. So this peroneus longus and peroneus brevis, they will be into this peroneal compartment. So there would be peroneus longus and peroneus brevis. They will be into this compartment, right? So obviously now you know this. This is an anterior crural, and that one is the posterior, right? You know that, I'm not labeling. And this outer one, right? As we said, this is anterior side, right? This is anterior side. So it has to be anterior component, right? Compartment. So that is anterior compartment, right? Anterior compartment. And in anterior compartment, there are four muscles, right? Out of which we have learned just the tibialis anterior. Rest of the muscles we have not yet touched, right? We'll see them. So I'm just writing +3, correct? So this is fine, right? I'm not drawing, say, that soleus, etc., because it is not seen very clearly. And this one is the just the posterior crural septum, right? So we are just watching it. Okay, moving further. Yeah. Now see this. All these, right? This is like we have removed almost everything, only the bones and the septa. So when we really draw something like this, that okay, this is the tibia, this one is the fibula, right? And then okay, and then they are like, there is intermuscular and interosseous, and here is, so this is that anterior crural, right? So that's what we are watching it over here, right? Only anterior crural intermuscular septum. Similarly, watch for this, right? Though they look so similar, but actually say same figure, right? That's the tibia, that's the fibula connected, and we are watching this portion. Say this very light, that one, another one, so that would be anterior, because see, they both are like this. So this is anterior, this is posterior, and that's what we are watching as the posterior intermuscular septum, right? And say over here, looks itself is telling everything, right? Because this is transverse. So just transverse intermuscular septum. Here it is, this one, right? That is transverse all the way from tibia, fibula. It is just covering the entire part. Okay. Now see, we said that there is inversion, right? Inversion. Now this is important part. Inversion is by, and we said that it is by tibialis anterior. We are adding one more muscle with the joint operation with tibialis posterior, right? With tibialis posterior. So tibialis anterior and tibialis posterior, right? One is anterior, one is posterior, and still they are causing inversion? Yes, they will. And this would be very interesting to see that how they really perform this function, right? Another thing is that when tibialis anterior is in with joint operation with other muscles, it will lead to even dorsiflexion. So that's what we'll see. So this is first part. That is the inversion, right? This is what we'll see. Second part, the eversion. Just to recollect, when we say inversion, that means sole will be facing inside, right? Sole facing inside. Eversion, the sole would be facing outside, right? Later. And this eversion, it has to be by, well, it has to be by those muscles which are on the lateral side, right? Because when they will contract, they will pull the lateral side up. So when the lateral side is pulled up, yeah, sole would be facing out, correct? Sole would be facing out, as if you are feeling it in your own feet, right? Okay, so that would be by those peroneus longus and the peroneus brevis. There is even tertius playing this role. So this would be interesting because tertius is going anteriorly, right? We'll see that. Okay, so this is like our agenda. This is like our primary target to see whether they are all fulfilling each and every moment. Okay, okay, coming back to the business. Now see, first thing first, we need to see tibialis posterior, right? So here is this tibialis posterior. Tibialis posterior. I was to tell you something. Okay, because we are just changing the topic, that's why let me discuss it for just a minute. I got several mails telling about that, yes, the way it is going on, right, we should continue. Yeah, there were two emails where means no offense, it's absolutely fine because everyone has got right to speak. So where it was said that can we go a bit faster, right? But it's like a gentle request to both those friends. Say you both are seniors, right? That's good that you mentioned it. But say we need to look at our those friends which are in first year and they have taken admission after you, right? So I think we'll go at the same pace, but yes, that's okay, right? As you said that we should not revise. I feel that say there is something like our memory system, right? What memory system is, this thing would be useful to even you also while studying say medicine or surgery or obstetric, and yes, we'll take those topics or those subjects also. The memory system is that whatever we learn, if we don't revise it within, say 90 minutes, right? It happens like you'll be surprised that you start forgetting. But if you revise it in within 90 minutes, right, then this piece of information will stay in your mind for at least another 1 day. Now, the best is the moment we complete our session, before you go to sleep, you revise it again and then see the fun. For next 3 days, you won't forget. Meantime, we'll be conducting that exam, so you'll study again, and then the best part is that you'll remember it for over a month. One more revision, you'll remember it for almost 6 months. So just within 4 to 5 reading sessions, the entire topic will be yours for years together, right? So that's the only intention of mine, to go for that revision, right? Still, it's like I respect everyone, right? So that's completely fine. What you said is that precious, I wouldn't just not agree with that sentence, that precious time is lost. It is not lost, right? There is no harm in studying, say, few things. Again, even I know you know that thing well, but just for the sake of our friends, right? So that's, otherwise got several of the mails where it was said that yes, we should continue the same way. So we'll continue with the same way, right? I'll not try to finish lower limb within 1 or 2 sessions. Yes, it will take 3 or 4 more sessions. Okay. Don't feel bad if I'm not agreeing to you, but it is like in benefit of everyone. Okay. Thank you. Coming back to this is tibialis posterior, right? And here it is. Posterior means it is posterior, right? So here it is, that's the posterior. Just look at it. It tells that yes, we are dealing with the posterior part, right? So here it is, tibialis posterior origin. Yeah. Very good. I never thought of this. This is like, Neha, this is good. Right? You can, because if there is revision, so after 2 3 times watching the whole video, you can straight away go to the revision part and it's done. Well, see. This is also a very, very valid and very good point. Agreed. Okay. So here it is, the tibia, fibula, and on the posterior aspect, if we see, this tibialis posterior is emerging from the back of tibia, interosseous membrane, and back of fibula. Correct? So tibia, fibula, plus interosseous membrane. Right? And then see where it goes. Because our purpose is that how it works in association with tibialis anterior for the inversion. So here it is. What it really does is, this passes behind medial malleolus. So where was this tibialis anterior? Tibialis anterior was going in front of the medial malleolus, right? You remember that? Tibialis anterior was going like this, right? Like this, and this one will be going behind. Now see their joint operation, right? So this passes, that is tibialis posterior, it passes behind medial malleolus. One other interesting email was also there, where they said, can you cut down the figures? Gentlemen, it is okay. Means it is to cut down the figures, but what's the harm? Because it's like on one screen, just one point is to be remembered, and that would be the key thing, right? Yes, we can just fill up the whole screen with 10, 12 points, but trust me, for the revision, it will take hell lot of time as compared to just scrolling this file, right? Because when you'll revise, you'll just see it like, okay, behind medial malleolus. Not only that, you will just watch this, done, chalo aage, right? You'll be able to revise it much faster. Still, because you wrote it in so much of length, just for your satisfaction, once we'll just try a small topic that way, where just in one figure we'll try to fill the whole page, then see what happens, right? Surely it would be more confusing. Okay. But I like your emails where you keep on telling everything, and yes, it happens. Sometimes I don't know. It in one of the session, I said that tibia is lateral, right? I have not yet checked it, but well, maybe after effect of corona, right? I don't know. Okay, if it has happened, I'm sorry. Chalo. Coming back to this is the tendon which we are talking about. So this is tibialis posterior, and this tibialis posterior, because it has to pass behind the medial malleolus. Now here is the flexor retinaculum, right? That's the flexor retinaculum. So it goes underneath. So this tendon right? TP tendon, tibialis posterior tendon, it goes under this flexor retinaculum, right? And then it comes out and see it fans out, right? It spreads. So it fans out, and where it goes, and yes, this is the medial side, right? Flexor retinaculum, medial side, medial malleolus. So we are dealing with the medial side. Not doubting about your intelligence, just writing for the sake of convenience. Here it is. Here it is. See, because it fans out, right? That's the reason that is its insertion is wide, right? We are dealing with tibialis posterior insertion, and we use the word it fans out, means it spreads. Tibialis anterior was pinpoint, going just at those two locations. Tibialis posterior is fanning out, and it is going where? See, so many areas. First one over here, that bone, which bone it is? It is navicular. True, right? Because that one, this one is calcaneum, this one would be talus, so obviously this one would be the navicular, right? And then that one would be the cuneiform, right? The first cuneiform. So I'll just write C1. So here it is. So it first goes onto this navicular, right? See where it is connected, navicular. Then also to this first cuneiform, right? And still more important, say this one, this one, that one would be the first metatarsal, right? This one would be the first metatarsal, so we'll just write M1. Then there would be M2, M3, M4, M5, right? So here, 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 and even on M2. So we'll just write it like this, right? We'll write like this, that it goes on to the base of second, third, and fourth metatarsal, right? So that's malleolus location. See, malleolus is that bony prominence on the medial aspect of your leg. You just touch the most prominent part. The most prominent part on the medial aspect is medial malleolus. On the lateral side, it is lateral malleolus, right? They are the bony prominence. And thank you, yes, we'll be working on that also, surely. Okay, so here it is. So tibialis posterior insertion, as we said that it fans out. Yes, it fans out on so many bones, right? Navicular, cuneiform, and the base of second, third, and fourth metatarsal. So that's how it spreads. Okay, let's dive deep. Now it is clear, right? Zoom. And here it is. Here it is. It passes behind medial malleolus, and see, this is medial malleolus, right? That's the medial most bony prominence. So that's the medial malleolus. It passes behind and it fans out. And by the way, this one is tibialis anterior, right? This one is tibialis posterior, right? One is anterior, one is posterior. Now you can recollect it like that. If this is the medial surface, right? So one tendon is connected here, another is connected here, that's okay. One is coming from anterior, one is coming from posterior, but when both of them, they will be contracting, so obviously they will be lifting the medial side up, and that's what is nothing but inversion, right? That is inversion. So that's how with the joint operation of TA and TP, they lead to inversion. Okay. Right. Just same thing, right? That's tibialis posterior. Okay. right. To see it with still more clarity, right? This one is tibialis posterior, right? Now, in order to see this thing, we have cut down some of the flexor retinaculum, right? Because otherwise, the flexor retinaculum, it covers almost up to this point. So, small portion has been cut down to see better tibialis posterior. Right? Okay. So that is tibialis posterior, and here it is, that is the tibialis anterior. So they are inverters, or the right, they do the inversion, right? Their function is inversion. Okay. The next is eversion. So for eversion, we said that we'll be dealing with those peroneus, right? Peroneus longus, peroneus brevis, and even peroneus tertius. There are three things to understand when we talk about peroneus, right? It's like it's okay if you forget everything, but just 2 points, they are very important. Third point, which is regarding the peroneus tertius. So as it is in anterior compartment, right now will not touch the PT, right? Peroneus tertius. Just deal with the brevis and the longus. Same, do remember those adductor brevis and the adductor longus. How was the situation? Adductor brevis was deeper. On top of it, there was adductor longus, right? Got it? Right. Same thing over here, right? Exactly the same thing. It is the peroneus brevis. So when we are dealing with peroneus brevis, it is also called as fibular brevis in some of the books. Otherwise, the peroneus is the common, but in some books it is mentioned like fibular brevis. Same thing. This is surely deeper. It is deeper, right? And peroneal region, fibular region. So yes, this is a lateral view, right? Lateral side. We are watching from the lateral side. Clear? This is the lateral side. So this peroneus brevis, right? This peroneus brevis is from distal fibula. Distal fibula. Now brevis means what? Brevis means short, right? This is a short muscle. So it will be emerging from distal fibula, because finally to all the whether longus or brevis, they will be landing in the foot only, right? So this gives us the idea that from where the peroneus longus should arrive, where should be the origin, what should be the origin of peroneus longus? It has to be the higher than brevis. Then and then it will be having a higher length, because finally the both of them, they are ending in the foot. So it's like destination is same, but longus has to travel more. So we make a wild guess that this should be the area from where the peroneus longus would originate, right? Let's see how much we are correct, right? So just writing it over there. So by the way, this is peroneus longus from distal fibula, a peroneus brevis from distal fibula, all good, right? Let's see this. Okay, now see, on top of, so this is the point, on top of peroneus brevis, here is the peroneus longus. It has to be bigger, right? Yes, here it is. It is the bigger one. To see it with still more clarity, let's see if we have got something. Yes, here it is. Here it is, right? That's the proximal. That's the proximal fibula, right? So that's what we were guessing, that then and then we can have a longer peroneus longus. So this is the peroneus longus origin. Okay, so this was the first point to understand. But over here, so this is peroneus longus origin. But here we change the color. That's the area which I really want to appreciate. Zoom, zoom, and see. Right? It's not the mistake, right, that something is missing over here. No, it is a deliberately there is a space. That is a space. So watch for this space. Some structure should be passing through it, right? So this is interesting thing. Let's see. And here it is. See, here it is. It is, so this is say tibialis anterior. This one, right? It has to be tibialis anterior because the lateral compartment and anteriorly it is the anterior. So this one is peroneus longus, and through the defect in that origin, it is the deep peroneal nerve which passes through this defect, right? So that's the reason that there is a gap in that origin, right? So it is this is another point which you have to remember. First point being that peroneus brevis is deeper, peroneus longus is superficial, and this is the second point. Okay. Back to our white color. Okay, so this one is peroneus brevis. Pretty easy, right? Just it is emerging from the distal half or the distal fibula. And see, it is going over there. All right, so this is fine. Just behind this, there has to be peroneus longus, and he is a bigger muscle, right? It has to be. So here is the peroneus longus emerging from proximal fibula, and it is covering, and yes, this is superficial, right? Or instead of superficial, we just write on top of peroneus brevis, right? So on top of peroneus brevis. Now see this one, right? Now this is easy, right? That you can immediately say, because compartment wise you know that okay, this is the anterior compartment and this is tibialis anterior, right? See, it is going on the opposite side, right? Okay. Now in the anterior compartment, right? Say that one, that is the anterior crural intermuscular septum. So that is tibialis anterior, and here is what has been highlighted over here. That is peroneus tertius, right? It is peroneus tertius. Now this peroneus tertius, interestingly, see where it is going on the lateral side. So though it has got the origin in the anterior portion, but when it pulls the lateral side up. So now it is clear that for the eversion, it is the peroneus longus, peroneus brevis, and the peroneus tertius. All of them, they will be taking the joint operation, right? Okay. See, now thing is, say just behind, right? Just behind the lateral malleolus. So here is this bony prominence. This bony prominence is lateral malleolus. Okay, lateral malleolus. These malleolus, these are the bony prominence. And both the longus both the longus, peroneus longus, and the peroneus brevis, both of them, they are passing behind, right, behind lateral malleolus. And there would be one more thing. This is the lateral side. So lateral side is peroneal. If it is peroneal, so there is a retinaculum also, and its name would be the peroneal retinaculum. And the function of all these retinaculums are to prevent the bowing, right? To prevent bowing of these tendons, right? To prevent bowing. Bowing is like, say, these are all the tendons, they are going all the way. If there is no one to press them, right, when during the action, right, they will all be pulled up. So that is what is called as the bowing. So in order to prevent that. The third point which you were supposed to remember is that at the lateral malleolus, it is the longus which is behind and the brevis is in front, right? So watch this. Zoom, zoom, and here it is. See, this one and this one, right? So it is behind, it is peroneus longus, and this one is peroneus brevis. Okay, so brevis is in front, and it is this brevis. It is this brevis. Now I'm tracing this brevis, and here it goes, right? That's peroneus brevis, right? Peroneus brevis. So what about the peroneus longus? Well, peroneus longus is super interesting, right? We'll see that what it does. Okay. So this peroneus brevis is quite sida sada, right? No complications. It's simply, right, peroneus brevis insertion, right? It simply goes to over here, right, over here, and that is nothing but, say, M1, M2, M3, M4, M5, fifth metatarsal, right? So on the base of fifth metatarsal, right? No complications, simple, sincere, and it goes to the base of fifth metatarsal. So that is peroneus brevis. Peroneus longus is not that sida sada. Yeah, just a better look, right? Here it is, right? Some of the retinaculum has been removed so that proper peroneus brevis, in fact, not only brevis, even the longus is also seen. So we'll just mark, say this is peroneus brevis, and here is our peroneus longus, right? Now see this peroneus longus, right? This peroneus longus, right? He winds around this particular bone, this bone, this bone, right? Which bone could it be? Well, not very difficult because to guess, because this is on the lateral side. On the lateral side, there is only one bone, right? And that is cuboid, correct? We'll have a look at from other angle also, but this peroneus longus tendon, right? It winds around cuboid bone. So this one is cuboid. This cuboid, and see, it changes the direction, and then here it is, right? All the way it goes to the base of first metatarsal. So in fact, this is like the direction. This is like the direction all the way. It goes like this, right? It goes like this, winds around that cuboid. Here it is, right? Here it is. This is calcaneum, right? And over there, that is the talus, and then you have got the navicular, and then those cuneiforms, right? And then this is where the cuboid is, right? So that's the bone which we are interested in, and this is the M1, right? That is, or the base of first metatarsal. So it goes all the way over there. Here it is, right? Base of first metatarsal. And we are talking about that's the peroneus longus tendon, right? Peroneus longus tendon. Okay, see, here it is. In this, say, we now watch the peroneus tertius, right? Say this is the anterior area. How can we say that this is anterior side we are watching? Well, watch for those retinaculum, right? Here is the upper and here is the lower portion, right? So now we know, and what is very clearly seen is this part. And what's that? That is the peroneus tertius. It is the peroneus tertius. Right, so that is peroneus, and now you know that tertius means third, correct? Tertius means third, and we can appreciate that these peroneus, that means they are like buckle, right? Well, they are buckling around that malleolus and then they are operating, right? Now don't ask me, you might say that okay, even the tibialis posterior was also doing like that, right? But well, they, because they are in group, so that's why this name has been given to them. Okay, so that's the origin of peroneus tertius, right? Peroneus tertius origin. See, here it is seen with much better clarity. Here is peroneus tertius, right? And yes, it has to be going under retinaculum because everyone has to go under the retinaculum, and this is anterior, so under extensor retinaculum. And where would it end? That's the final destination for peroneus tertius, and it will end at base of M5, right? Fifth metatarsal, right? Now you know M1, M2, M3, M4, M5. So that's the final destination for peroneus tertius. So this is how things really operate, right? When it comes to those, all the peroneus gang, right? So all these three, they will be going for eversion of food, right? Eversion. Because they are on the lateral side. From lateral side, when they pull, so obviously the sole would be facing outside. But think of when these peroneus, they work with anterior muscles. That's where in this joint operation, they'll be doing the dorsiflexion, right? That's how they work, right? That is the dorsiflexion. For plantar flexion, right? Those three big bosses are there, right? Gastrocnemius, soleus, and plantaris, that we have already talked about. Say, important thing is that why such intricate systems? They are important just for one reason. They are important just for one reason. It is like balance, right? Balance of our body when we are walking, running, right? Or even when the surfaces are uneven. Interestingly, the fastest thing on this earth, right, something which is on four legs, is cheetah, who goes at the speed of say almost 110 kilometers, And the best part is its pickup, 0 to 110 kilometers in just over 2 seconds, right? And there is a very nice film by Alan Root on National Geographic, where he was in Nissan Sports, and they were even shooting, and still there were blurs, right? There were actually the blur, because it was a long shot. It was literally like a streak, lightning streak, right? Within and with a counter, right? Under 2 seconds, cheetah picked up, because its entire leap is so big. So what really happens is, he has explained it very nicely in that it is because of his hyper flexible back, right, which acts like a spring, and his legs, right, there, that those ankles, right, they are so powerful to take this jerk. And then for the balance of the body, right, it is the tail which is balancing, and that's how the cheetah is leaping. Because every leap, this entire full length, the length of the cheetah is 6 feet, so this is about 6 feet, just 1 feet here, 1 feet here, that is another, and this tail. So it means when on full stretch, that cheetah is, it is almost 7 to 9 feet. And then that leap, it takes off, and then where it lands, right, that is over 15 feet. So when you compare that, normally our rooms are like, say, 10 feet. So it is like just in one leap, he is crossing more than that distance. Right? The name of the film itself is Fastest Thing on Four Legs. Right? Very interesting. Okay, so that was for today. Let's go for a very high speed revision, right? And let's start with that. Before that, let me save this file. Done. So let's start. Regarding nerve supply and the blood supply, right? Next time we'll be focusing only on that, right? So that's why we are not discussing it right now, else we'll deviate from the topic. So let's start with changing a different color, and let's start. Here it is, ankle movers part 2, right? We'll be dealing with the fibrous septa, and then there is transverse intermuscular septum, anterior and the posterior crural intermuscular septum, right? They are dividing, transverse dividing into superficial and the deep part. Anterior is anterior and lateral, and obviously the posterior is between lateral and superficial posterior. So here it is completely clear, and that's the anterior, and this one is the posterior crural intermuscular septum. This one is transverse, right? Okay. Deep fascia, we just remove that. We will also cut the gastrocnemius and soleus so that we see the things properly. Here it was that where the gastrocnemius and soleus, they'll be meeting the calcaneal ligament, divided, cut, muscles cut, and we really see this transverse intermuscular septum, which is quite thin or above, and it becomes denser and denser as it goes below. Muscles are divided, fascia divided, and that's the attachment on tibia and all the way on the opposite side on the fibula. So that's how the entire transverse intermuscular septum will be dividing, right? Here it is, as we go below, here it is thick, and it continues with the flexor retinaculum, right? And that's the image, once again drawn just for the understanding. Okay, right? Here it is, same thing. And a zoomed version shows us that there is, here it is like, here it was like anterior crural and the posterior crural. So we just zoomed this thing for a better understanding. Anterior posterior sides, anterior crural, and here is the posterior crural, because this is posterior side, so that's the soleus muscle. The lateral compartment, also called as fibular compartment, also called as the peroneal compartment, and that's what we are watching from the lateral side, right? And here it is, anterior crural intermuscular septum, and that's what we said, lateral, fibular or peroneal, and this one is the posterior crural, anterior crural, all known to you. And these are the peroneal longus, brevis, and the tertius. These are the muscles which we'll be dealing with. On the lateral side, lateral component, only this longus and brevis, right? On the anterior side, we have got the tibialis anterior. Now we know one more, and that is peroneus tertius, right? So we are writing it over here. So it means now there will be +2, correct? All right. Here it is, anterior crural, posterior crural, and the transverse intermuscular septum. Inversion is by tibialis anterior and tibialis posterior, but now there is no mystery because both of them, they are landing onto the medial side. So that's where they'll be lifting it collectively. Tibialis anterior coming from anterior, posterior from tibialis posterior. Right? Eversion, when the sole of the foot is out. This is peroneus longus, brevis, and the tertius joint operations. Right? Here is tibialis posterior, and well, that was the memory system which we talked about. And this is tibialis posterior on the back side from the tibia, fibula, and the interosseous membrane. And that's the point, that it will be passing behind medial malleolus, right? Remember that thing, and passing behind medial malleolus under flexor retinaculum, and it will fan out. When it will fan out, that means it has to go on to, it will go on to the navicular bone, it will go to the first cuneiform, it will go to the base of second, third, and fourth metatarsals, right? So that's the reason it has to fan out. Before ending class, please tell about myself. Okay. Just I am your friend. Take it that way. Okay. So this is tibialis anterior and tibialis posterior, right? One is anterior, one is posterior, and just a zoomed version. And finally, both of them, then when they will contract, right? So they will be leading to inversion. For eversion, longus, brevis, and tertius, peroneal part, and that's the lateral view. Here is the peroneus brevis. That's point. This is deeper. Peroneus brevis is deeper, also called as sometimes fibular brevis. It is one and the same thing. Peroneus brevis, right? That's where it emerges. Distal fibula, right? Fibula, not fabula, fibula. On top of peroneus brevis, right, there is peroneus longus, bigger muscle, right, and it has to come from the top, then and then it can be bigger, then and then it can be longer. So here it is from the proximal fibula, peroneus longus origin, and there is a gap. Here is a gap. That's what we need to see. That gap is intentional because that's the gap through which the deep peroneal nerve will be passing through, which we'll be watching next time in more detail, right, with all the images and everything, even with the real specimens. All right. So today we just remember that it is the peroneus longus origin defect that's through that's deep peroneal nerve. And here is on the anterior side, it is the tibialis anterior. That's the peroneal brevis. Just have a look at it. On top of it, peroneus longus. And this is a tibialis anterior. That's anterior crural intermuscular septum. And that's what we watch. That yes, this is the anterior compartment from where we see the presence of peroneus tertius. That's lateral malleolus, and behind the lateral malleolus we have got this couple peroneus longus and brevis, right? They are going. Peroneus longus is behind peroneus brevis, right? Is a brave and he is in front, right? So this is good, right? He is brave. So front. Now don't call that peroneus longus is a loser, that's why he's behind, right? Don't degrade that muscle, right? Bichara is so good. In fact, it plays a major role in this movement, eversion, right? So this is good. Right? This is more positive. And yes, peroneal retinaculum, all these retinaculum, they prevent bowing of the muscle, means that tendon won't come out. So this is peroneus brevis, right? Very Siddha Sada, base of the M5, and that's it. But this peroneus longus, right? Say, he is not a loser, right? He'll take a turn, he'll wind around the cuboid bone and will go all the way to the M1 base of the first metatarsal, right? And that's the peroneus tertius anteriorly, and This tertius means third, peroneus means buccal. This peroneus tertius, that's the origin from fibula, and it comes down under extensor retinaculum and ends on M5, base of M5. So that these are the three peroneus for eversion. With the collaboration of anterior muscles, it will lead to dorsiflexion, and all these things, they are super important for balance, right? So we meet tomorrow and we'll have a look at it, look at the vessels and the nerves of related to ankle joint, right? Thank you so much, and we meet tomorrow. All right. Thank you and bye-bye.